Hello everyone, this is Gisele. Today I'm going to interview a doctor lecturer from Giseles University, Lakeside campus. Have a look. There is a reason why I choose to interview a doctor. I always wanted to become a doctor since I'm really young. It all started when my grandfather was sick 7 years ago. He seemed so helpless in me. When I get to see my grandfather like that, I feel so sorry for him. And another is I can help him too. And the good news is he became much better after being cured by a doctor. That's when the idea struck to me. The world is populated with many people, and who knows, there are some people who is not suffering like my grandfather. I'm sure that there are a lot. I want to help them too. I want to relieve the pain that they are suffering from. That's why I decided to become a doctor. Wait, what you waiting for? Now let's go to interview. Hello sir, my name is Mama. Very nice to meet you.
Nice to meet you too.
For the purpose of the interview, would you like to tell your name and the career of your choice?
My name is Dr. Nalamolu Rao. I've been working as a senior lecturer in School of Medicine. I'm teaching pharmacology, which is normally treatment of any disease. I'll be teaching all the drugs, how they work. This is my job here.
Okay, so at what point of your life you decided your career?
When I was doing my pre-university course in India, then I was thinking of health-related problems. So at the time I decided why can't I go for a health-related educational field. There I got an interest. I went to hospital where my uncle and aunt was doctors in a government hospital. And I went there, saw all the treatments, the conditions there. Apart from that, I was fortunate to see the post-mortem of a dead body. Then I got interest and we tried to treat.
So who influenced the decision for your career? Is it like your own choice or someone forced to do that?
No force. For me, my parents had given me whatever you want to do, we just support you. That's the statement given by them. So I have searched my own. I took all my friends, uncles, their suggestions. Then I decided myself, no force for me.
So what skills are necessary for your career?
Basically, when you want to become a doctor or you want to become a person who is involved in health-related field, you must have patience. You must be sincere, time-bound, hard-working. Majority of the times you will be on call 48 hours, 24 hours. You cannot complain that I have so many commitments outside. Sorry, I can't perform the surgery. Where that requires commitment. That requires a lot of what do you call it as sincerity, hard work. Everything is required. Apart from that, you also need talent, which is acquired, not by birth, but during the process of education. You must be completely concentrating on what you are learning. That will make you to get a high talented skills. There you will stand as an efficient employee for any hospital or anywhere.
So how you were passionate about this career path? Like, can you give me an example of what you have done?
I've been involved in diabetes research from the past 14 years. I was, when I started my master's and then after completing my master's, I was trying to find a remedy for diabetes because current medications were having some side effects. There we developed a lot of herbal, we have done research on many herbal drugs and we found promising drugs. And we are now trying to formulate them. And the current project is going on treatment of diabetic ulcer, where it is very difficult to heal it. So we are working on that.
That's very nice. How does the market look like now? Is there a job for me if I graduate today? And how will the market look like 10 years later?
Even 10 years before, now 10 years later, there is market. Disease will never die. As long as human is alive, disease will be accompanied in our one or other ways. In this aspect, even you have a drive, passion for doing medical degree, then you must decide in yourself, I am going to become a talented doctor, not the doctor of ordinary skills. So when you become a doctor of talent, high skills and talent, everybody will run behind you always. That's the measure. And another thing is Malaysia is growing. The population is growing. Diseases like diabetes, hypertension, cancers are more prevailing. So to eradicate, to treat better your patients, doctors are required, especially in terms of still Malaysia lacking neurologists, neurosurgeons. There is a serious requirement. There is requirement always, but only thing required is when I'm going to be a doctor, I must be talented. I must have skills to perform, treat the patients in the best way with optimized therapy and economical treatment. That's the major thing.
So, what are the first and second-hand experience I should get if I want to pursue your career path?
The first thing, when you are deciding as a doctor, you must be having a fundamental knowledge of biology, especially a cell. When a cell is there, what are the parts of the cell? Cytoplasmic contents, cell membrane, outer membrane constituents. You must be aware of that. And you must also be aware of fundamental parts of the body, human body. In your lower levels, everybody teach you kidney, heart, liver, brain. So if you have a basic fundamental knowledge, then when you come into medicine, especially as I told, the anatomical parts, are biochemical pathways like glycolysis, Krebs cycle. All these are you are learning in your basic degree. Apart from that, you are also learning how the function, how an eye, vision, physiology of vision, physiology of hearing. If you learn all these fundamentals, when you come here, you won't be searching here and there. Glycolysis, I never heard about it. Then acquire fundamental knowledge. There you will get a basis for it. Then when you enter into medical degree course, you will be excelling through very well. That's things.
So, how physically demanding is your job?
Physical fitness is definitely required for any job. So as a doctor, apart from physical fitness, one must have mental fitness as well. You can't be psychic, or you can't be restless towards your patient. The patient will not get the proper therapy, isn't it? Unless your patient opens his heart and tells you everything, then only you will know what happened exactly. So you must be physically fit, you must be also mentally fit. But that's disabilities, physical disabilities will not counteract or will not inhibit practicing as a doctor. Definitely. Okay.
How many more physics courses you were taken after your high school?
After high school, I have taken my pre-U course. After completing the pre-U course, there was a common entrance examination where 100,000 people were competing. We have very less seats. That examination, I have taken training and attended for it. I got the rank, then I could able to enter into the public university. That is my progressive pathway.
So how did high school and university physics affect you happened to your decision for your career?
Definitely because school level, they were teaching this is heart, this is liver, heart have 4 chambers, and these are lungs, these are kidneys, like bean shaped. Then I was like very interesting and curious. I felt too curious about that. Bean shaped kidneys filters the water, and majority of water gets reabsorbed. Only few amount of water will come as a urine. That made me much curious about it. I want to learn much more. That's where when I entered into the pre-boards, I was studying. Apart from that, I was attending with my uncle and my auntie to hospital. I was seeing all the needles, tablets, patients, surgeries. By seeing one by one, I got interest. This is a very interesting field, curing, and when my uncle cured a particular disease, I've seen an incident. They directly touched his feet and told, "You are the God." And then I felt, wow, this is fantastic. So I got the interest like that.
How much physics you use in daily life?
Physics. Yeah, life is physics. Always. You have to walk, you have to see, you have to hear, you have to talk. Everything is physics. Physics is integrated part of our life. Definitely. If my heart is beating, the dynamics of heart, it's physics.
So, would you choose the same, but if you have to choose again?
Definitely yes.
Why?
Because I want to do research and find something for at least one disease. Advanced medication which will be safe, don't have much side effects, very effective. Even a common flu, diabetes or hypertension. If I will take rebirth also, I will do the same. Because this is an interesting field where you will save patients' lives. That's the advantage here.
So this is all our interview. Thank you so much for allowing me to interview and giving me your very precious time.
Thank you very much. I have a good time. Nice meeting you.